We know that everything that happens in the body happens through cell communication. And that cell communication is largely by photons. Rather amazingly, our bodies are electrical machines, but a lot of the cell communication is by photons as well as other forms of electricity. And Dr. Troy Dutt has found that you can manipulate this energy and these communication mechanisms by using a series of equipment. It is a fascinating insight into how our bodies work. Hendrick, thank you.
Thank you, David. Well, once again, thank you, David, for the invitation. Ladies and gentlemen, good morning. No, not quite. Just to say at the beginning, I don't treat cancer patients, but I was involved in treatment of these patients in my first medical life as a head of a radiology department in a hospital, and in my second medical life as the president of the German Society of Energy Medicine. You have heard yesterday and today a lot of very scientific, of excellent scientific presentations on our topic, and interesting and important observations.
Could you hold that microphone closer, please?
Closer, okay. A lot of interesting and important observations on the patients. By the way, there's the word anecdotal. 1 week ago, there was a congress here in Frankfurt. I was attending that, and Rupert Sheldrake was talking about the word anecdotal. He said, I want to find out what that means. And he looked it up and said, it means nothing else than just not published. So you can be proud if you have anecdotal observations. It just means it's not yet published. Okay, and I want to tell you, after these scientific speeches, you can relax now. What I'm going to show you is more or less entertainment. Okay, next please. A few observations that are not new for you. The next please. The situation, the medical, pharmaceutical, industrial complex is an imperium. We know it. Next please. This imperium dominates medical research by funding the universities. This, for example, is the Nobel Prize winning of Professor Zuhausen. The Deutsche Krebsforschungsinstitut has 1,500 employees, 650 scientists, 50 professors, and a yearly research budget of 140 million euro. Next, please. And the imperium, I will just call it this way, dominates medical activities by guidelines, and we have to speak about guidelines. This, for example, is the so-called S3 guidelines. Next, please. And one should know that the guideline authors are all connected with the industry. More than 10 years ago, there was a study in the US. 192 guideline authors were asked about their connections to the industry, and it turned out that 0% of them were really independent. Next, please. So, you should know, if you will, that these people that the industry is everywhere. Every fourth self-help group is sponsored by pharmaceutical industry. Next, please. And this is a very funny explanation I found in a book. The Professor Möller, he's the chairman of the Brain Liga, sponsored by manufacturers of the Alzheimer medications. He said, Alzheimer medications are not really effective, but cancer patients do get medications with the same poor effectivity. That means if you spend money for the cancer therapy that does not have any help, why don't we get any? We can't offer any help either. Well, next please. Back to the S3 guidelines. I have marked a few there's a few points with a red line here. Biopsy, 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 biopsy. What does that mean to the patient? Next, please. I want to mention the work of Professor Krokowski 30 years ago. Nearly no oncologist knows this work. Krokowski made a study in nearly 600 patients, and what he did was that he thought, what happened to him? We have metastasis growing. There must be point 0 when it starts. What happened on point 0? And he found out on point 0 there was either a biopsy or an operation. Next, please. That means the biopsy starts the activation of tumor stem cells, what we know meanwhile. And a few years ago there was a publication in Lancet that says biopsy probably starts metastasis. Next, please. So, even before conventional medicine or anyone has started the therapy of the cancer patient, this patient has a heavy burden and a heavy risk on his disease just by getting the diagnosis before they started. So avoid biopsies or surgery if it's possible, or combine it if it's possible with Gcmaf, but you have to wait for 3 weeks till the immune system is really built up. Don't trust the guidelines. That's what I want to tell you before we speak about the therapy, and maybe this is one of the most important sentences in my speech. Follow the money, then you know the interest of the different groups. Next, please. Okay, how can the effectivity of Gcmaf be improved? Combine it with different methods, establish synergistic effects, and avoid interferences. Is there a system? How can you do this systematically? Next, please. We know, for example, that there are several cancer treatments with proven success, but not like a blockbuster. They are just helping in parts. For example, Gcmaf therapy, Budwig diet, photodynamic therapy. There are some more. Next, please. The iron induction therapy, hypothermia, prayer, selene. Next, please. Another ones. Vitamins, homeopathy, Hellinger systemic therapy. What do they have in common? Is there a hidden pattern that they help, but not the real blockbuster? Next, please. The explanation is the systemic application. We have different layers of effectivity, and I want to talk about this. Next, please. The organism is a system. In medical terms, we use the word system, for example, in circulatory system or nervous system, but it is funny, but the whole organism is a system, and this has special consequences. Systems, okay, a country can be a system, the earth, the company, bees, they are systems. There's a good definition. Complex systems consist of different parts existing in a definite dynamic order between them and linked up to an operational network. This is what we have in our organism. Next, please. Systems have an internal hierarchic structure. That is a very important observation. The different hierarchic levels are stabilized by cybernetic self-regulation. The word hierarchic is coming from church history. And we have first to talk about the hierarchies. Next, please. The hierarchy is, people don't like it right now. They think there's a boss who is the fat and wealthy, and the lower in the pyramid, the poorer the people look, the employees compared. But the hierarchy and systemic structure in nature has, for example, something like biofeedback, the possibility that wrong orders, wrong signals can be blocked by signals, or that for example, that there is no arbitrary order. It all makes sense. So this is a different understanding of hierarchy in a system. Next, please. We use in our society, for example, a multi-dimensional model of the organism. For example, these are five different levels of function and regulation. There are models with 3 levels, with 7 levels. The number doesn't make any, it's not important. The first level is the physical body, and if you remember, in these 2 days we were speaking nearly always about this physical body. The next one is the bioenergetic level with the electromagnetism. Then there is an informational level, scalar waves, quantum potential, mental level, emotions, thoughts, and a high, let's say, a spiritual level. Next, please. Just to explain it a little bit. Level 2, the level of bioelectricity, bioenergy, biophotons. Next, please. Level 3, information fields, scalar waves, potential fields, quantum potential. Here starts subtle energy. Here we say goodbye to conventional science. We have to accept that. Next level, please. Level 4 is the level of mental processing, interpreting and understanding the disease. Science does not only deny a meaning of disease, it does not permit this question, says Professor Fritz Popp. And the last, please, level 5, that is the level of fate, of karma, it's a spiritual level. Okay, so we have defined now our 5 levels. Next, please. The levels are stabilized by redundant cybernetic self-regulation. Conventional medicine is focused mainly in eliminating disturbances. Just a short explanation. If you have a room, if you sit in a room and there is a stove, a very hot stove, the temperature is rising, till a certain degree you can regulate the temperature for your body by sweating, but there is a point where the sweating does not work anymore, and if you want to survive you have to take out the stove, and that is called eliminating the disturbance. And this is how conventional medicine mainly is focused on. Next, please. If the cybernetic self-regulation is overloaded by external disturbance, the disturbance must be eliminated. Just what can be a substitution, a limitation, a detoxification. Next, please. So the conclusion of this systemic model: analyze and correct every level, optimize cybernetic self-regulation, if necessary, eliminate disturbances. This is a holistic treatment. Next, please.